Heat should not be used for sites of acute trauma or bleeding, as heat can lead to further blood loss due to increased vascular dilation and blood flow. Heat should not be used in areas of decreased sensation or anesthesia, nor should it be used with non-responsive or non-communicative patients unable to communicate to the healthcare provider that excessive heat is being applied. Doing so increases the possibility of burns and further pain. It should be used cautiously in those with neuropathies. Deep heat methods are produced by ultrasound or short-wave pulsations known as diathermy and requires skilled personnel to apply. Deep heat is particularly useful in the treatment of deep bone, joint, or muscle pain. Deep heat is not recommended for acute rheumatoid arthritis, as this approach increases cartilage degeneration, which exacerbates the disease process, and it is contraindicated in the treatment of Raynaud's disease or other severe peripheral vascular diseases. In these situations, the increased metabolic demand caused by the application of heat in the presence of a disease that has already caused decreased oxygen supply may lead to necrosis. Deep heat should not be used with patients with pacemakers or metal implants close to the energy source due to the increased risk of thermal burns. A second non-invasive approach to pain management involves the use of cold therapy, also called cryotherapy. It produces physiological effects that are the opposite of those produced by heat therapy. Cryotherapy reduces blood flow to the local area, causing vasoconstriction, thus reducing swelling, inflammation, and bleeding. Cold slows nerve conduction, producing a local anesthetic-like numbing effect. Cold is useful within 24 to 48 hours of the injury. For the treatment of strains, sprains, bruises, or contusions, the use of rest, ice, compression, and elevation, often referred to as RICE, may contribute to the healing process. Cold treatment is especially useful postoperatively with certain orthopedic surgeries and in the treatment of acute rheumatoid arthritis. The application of cold compresses is also useful in the treatment of headaches, minor burns, dental pain, and prior to therapeutic exercise. Cold compression also aids in reducing temperature in febrile patients.